Boylan. If you need anything from me, please feel free to send me a message. We're glad that you're here. I'm so excited about this training. I've been trying to get New Beginnings DVHopeline with us for a while. I think I've been talking about this since January. So I'm so glad y'all are with us today. My heart is with you because I used to work at New Beginnings for many years. So I feel a connection with New Beginnings, and I'm just really proud of the work that goes on at the DVHopeline and really proud of the folks who are running it. I've just had the opportunity to listen to you. I feel like you're so brilliant when it comes to working with survivors through the Hopeline, and I'm just excited for other people to hear and listen to what you have to share. So I will come back towards the end, and I will go ahead and turn it over to Shada, who is from New Beginnings, and I will pass it over to you, Shada.
Thank you so much. Good morning, everyone. I want to do a full disclaimer. I am someone who is typically used to 3 screens, and I am down to 1. With that will probably come with you getting to see the real life navigation of what's going on the screen. So I really appreciate the patience. And thank you all for joining us today. We are absolutely so grateful to be in community with you all, and also to have this opportunity to share our approach of how we do this really meaningful, impactful work, and also to have an opportunity to learn from all of you. So for folks who are like, why am I here? Hopefully it's no surprise, but you are attending a training today with Demystifying the DVHopeline and remote advocacy. We recognize that the DVHopeline is a relatively new program at New Beginnings. It's a little over 4 years old, so some of you may have heard of it. Some of it may be a new thing that you're learning in today's training. And to understand too that COVID did have impact on how we show up for folks doing this work, and a lot more orgs are integrating remote advocacy. Maybe even some have gone fully remote. And so we are going to be sharing our approach and opening up the opportunity for folks to share how they are approaching remote advocacy, to ask the curiosity around remote advocacy, and knowing that we have folks throughout the state. We also have folks who are joining us who may be collaborating with advocates. I heard there were some counselors that are joining us today. So really love being in community with you all, and we're going to go ahead and get started. And so just wanting to let you know that this training is going to be engaging, interactive, and informative. You can opt in of how you engage throughout today's presentation. And collectively, we really want to create a safe space for everyone to be able to share their ideas and be in community with one another. For our time today, we're not going to have any designated break times, but feel free to take the time you need to stretch, grab something to drink, and any additional needs throughout the presentation. There will be various times throughout the presentation that there will be pauses and transitions for another speaker as we prep to sharing our screens. So please feel free to utilize that time as well. This is being recorded, and we will be sharing our slides after today's presentation. So feel free to take the notes. Also feel free to be present, to listen, to view what's on the slides, because the slide deck will be shared out to everyone who's attending today. We encourage participation throughout the presentation, and we are aiming to get through all of our slides. Therefore, there may be moments when we may limit verbal share outs to make sure we get through the content. This is the first time we have implemented this presentation, and we have incorporated 2 scenarios into the presentation. We will not be going into breakout rooms for these scenarios. We will be staying in this main room as a collective to discuss, debrief, and share. We will be utilizing some Zoom tools. It's okay if you are super familiar and unfamiliar with them. We will provide a very quick kind of demo of how to participate with those various Zoom tools. And also there's the option of unmuting yourself and using the chat too, if that is the most comfortable way for you to engage in today's presentation. The chat will be monitored throughout the presentation. We may not answer questions in the moment that are written in the chat because we may be waiting for a pause to be able to answer verbally the questions that are in the chat. Also, the questions that are entered in the chat may be answered later. And so we are going to be aiming to answer all the questions that are provided today. If not, we will follow up with a Word document with responses that can be a supplement material along with the slide deck. So the four main sections of our presentation today is we're going to do an introduction of all the presenters that are here today, along with new beginnings. We are also going to be talking about the DVHopeline program and services and the team, and talking about the demystifying the DVHopeline. So even though we're relatively new, there are things that we commonly encounter with like frequent asked questions and things about the DVHopeline that we really want to ground in the services and the impact that we do have in the community. And then we're going to be sharing our approach to remote advocacy and inviting you all to share how you do this work as well. So I'm going to start us off with the introductions. So my name is Shayla Bibby, she, her pronouns. I am the program director of the DVHopeline, and I started in January of 2024. I bring with me almost 15 years of clinical mental health experience and over 12 years in nonprofit. My previous role was a director of counseling for a program that focused on providing trauma specialized therapeutic services for survivors of domestic violence and sexual assault here in Seattle. I'm a Midwest transplant, and I have been here since 2012, and I really enjoy the outdoors. For folks who are from the Midwest, there is maybe like a month you can be outside when there isn't chiggers, or the heat index isn't above 100, or the windshield isn't below 0. So I just really love what Washington's able to offer. I have a 2-year-old toddler that has really big opinions, and 2 4-legged creatures, a mighty Yorkie named Mozzie and a 19-year-old cat named Bob. And I also enjoy being at home with reading books and cooking and baking. You're going to be noticing as we present our email address and our hours that we are in the office are going to be listed also on the slide. And so those are for you all to reach out to us if you have any additional questions. I am typically in the office Monday through Thursday, 7 a.m. to 4 p.m. And then we have a manager, Karen Sumption, who is unable to join us today, and she has held 3 different roles at the DVHopeline, and she started in 2022. She was a relief advocate, also a lead advocate, and is now one of our program managers. In her spare time, she enjoys writing, she knits, and takes altogether too many photos of her cat. She is the manager on the team that oversees our DV CHAP. For folks who are unfamiliar with that, we'll go into it a little bit more, what that acronym stands for. And she works Tuesday through Friday, 7 a.m. to 4 p.m.
Hi everyone, my name is Jaskita Chavla. I also go by Jazz, and I use she, her pronouns. I have been with the DVHopeline since the end of July of 2024, and I work Monday through Thursday, 7 a.m. to 4 p.m. I oversee our full-time day and peak shift advocates. My background before joining the DVHopeline consists of working with survivors of sexual assault, domestic violence, and human trafficking, both in a higher education environment as well as community-based, working at DV crisis lines, rape crisis centers, and kind of your more traditional DV agencies. I am very passionate about increasing awareness in the community around intersection of DV and strangulation, particularly engaging in education opportunities for law enforcement around that area, and strengthening access to advocacy support for BIPOC communities. My manager role is also external facing, so I am grateful for the opportunity to have spaces where I am paid to talk and chat with folks and just continue building meaningful relationships to expand support for survivors. In my free time, I am spending every minute with my rescue, Pitty Coda. Anyone who knows me knows I talk a little bit too much about him, and sometimes he makes appearances in the background as well. Love spending time discovering new beaches and parks to take him to. And any free time outside of that, I am co-managing a bully breed rescue out in California.
Hi everyone, I am Zoe Montaigne. I go by she, her pronouns. I am also a program manager. I started in the DVHopeline from the very beginning in May of 2021. And I started out as an overnight advocate. And then I've kind of held every position except for program director at the DVHopeline. And I used to be a day shift advocate, relief advocate. We used to have a lead advocate position that I held. And then in July of 2024, I stepped into a program manager role. My background for the last 8 years has been working with survivors of gender-based violence from California to Washington. And a lot of my passion is working within my tribal community and other tribal communities for missing and murdered Indigenous women and peoples. And then I enjoy spending time with my family, exploring the Pacific Northwest, and just traveling and visiting family. I'm a big Disneyland person, and now my kids are big Disneyland people, and and spending time with my dogs. And I supervise our swing shift advocates. So I work Saturday to Tuesday from 2 p.m. to 11 p.m. And I do quite a bit of like data things and behind the scenes work with the DVHopeline, as well as working with the address confidentiality program.
Great. And so now, as you all kind of got a little bit more familiar with us, sometimes folks think that the DVHopeline is the only program at New Beginnings, and we actually have 5 direct service programs at New Beginnings. And so I'm going to just share a little bit about each of these, and please feel free to reach out to us or also call the DVHopeline if you know of clients or yourself if you want to talk about any of these programs. So New Beginnings Community Advocacy Program, so CAP is the acronym, offers support services to survivors of intimate partner violence. Advocates help with safety planning, support groups, parenting advocacy, referrals to community resources, legal advocacy, emotional support, housing advocacy, and more. Services are survivor-driven and tailored to meet the needs of each individual. Social Change is the dating violence prevention program. They facilitate a 12-week healthy relationship curriculum with small groups of students in the Seattle Public School District. Specifically the middle schools. They also support youth leaders and peer educators at Ingram and Shorecrest High School and offer summer leadership programs. In addition to their direct work with youth, they also facilitate trainings on dating abuse prevention for parents, teachers, and youth service providers. We also have a behavioral health program that is a MID initiative. So MID is mental illness, drug dependency, that provides accessible mental health intervention combined with an integrated advocacy and other support services, decreasing the risk of mental health concerns and other negative impacts of domestic violence, and increasing survivor stability and capacity to cope. They offer groups as well as community referrals. Home Safe is a low barrier trauma-informed emergency shelter program for survivors of gender-based violence. They have 17 private units. They can provide up to 6 months of holistic support, including advocacy, housing, navigation, childcare, legal aid, and more. They prioritize BIPOC immigrants, LGBTQIA+, and other marginalized communities. And then the 5th direct service program is the DV Hopeline, which we will be diving into the advocacy that we provide throughout today's learning series. But before we do that, we are going to have our first interactive component of the presentation. We are going to have 2 polls that we are going to launch. And the 2 questions are going to be, have you heard of the DV Hopeline prior to this presentation? The options are going to be yes or no. The second question is, have you reached out yourself or referred someone to the DV Hopeline? And the answer is going to be yes or no. So I'm going to go ahead and launch those and then give folks the opportunity. These are anonymous, but I can see how many people have responded. And so that is going to be how I can tell when we're getting close to the majority of folks responding. So I'm launching them now. And so folks, go ahead and answer the 2 questions. All right, we still have 10 holdouts. Let's go ahead and get those folks to answer. There's 2 questions, yes or no. Give folks another 30 seconds. All right. 10 more seconds, and then I'm going to end the poll. We're at about 80% of folks who have participated answering. All right, I am going to end the poll. I'm now going to share the results. So as we can see from the 2 poll questions, a little over 54% of folks who are here today have heard of the DV Hopeline, and then 46 are curious, and so we welcome both. And then also noticing that 71% of folks who have been here haven't reached out or referred someone to the DV Hopeline. And so we really appreciate these external facing opportunities to be able to uplift the services we do, because we can support you all as well as providers and the clients and residents that you are working with, and we can continue to expand that network of support for the folks that you interact and engage with. So I really appreciate folks who answer those questions. It kind of gives us an idea of who's all in the room, and that will help also as we facilitate some of these activities. For folks who have not heard of the DV Hopeline, one of the engaging opportunities that we are going to have is being able to do kind of like an elevator pitch. So if there's a few things that really capture your attention as we go through an overview of the DV Hopeline, if you have a piece of paper and a pen to just kind of jot down those information, or if you're someone who likes to use your phone to take a picture of a slide, that can be helpful with your engagement in one of those activities that we're going to have. All right, I'm going to head and going to stop sharing the poll, and we're going to continue through the presentation. Thank you everyone for participating. All right, so as we have kind kind of established, we have different familiarity around the DV Hopeline in the room. We might also have folks who are in this virtual space with us who have 10 plus years of advocacy. And we also may have folks here who today is their first day or first week providing this meaningful and life-saving work. And so just being able to understand that we have immense gratitude for each and every one of you for being here today and being part of the ecosystem to be able to end gender-based violence. So there was a time when the DV Hopeline didn't exist, and there was so much interest and support and momentum to locally create a domestic violence helpline that provided 24/7 advocacy support. And we might actually have folks in the room today that were instrumental with advocating, creating, and supporting the DV Hopeline since day one. On this slide is some of the community stories that illustrate why there was so much interest, support, and momentum to create a local DV hotline that provided 24/7 access to advocacy support. The DV Hopeline took its first calls in 2021 to help with mitigating the impact of these community stories, that there was confusion, multiple phone numbers to remember, lack of coordination, having to repeat your story over and over, calling many places to get the help that you need, calling and no one answers the phone, and figuring out the complicated system on their own. So at the DV Hopeline, our vision is for the DV Hopeline is that each call or contact will advance a survivor's journey to autonomy, safety, and freedom, and strengthen our community's resolve to end gender-based violence. We recognize the causes of DV are rooted in the intersection of multiple forms of oppression, including sexism, racism, homophobia, and transphobia, xenophobia, ableism, and economic inequality, and that DV occurs in all racial, religious, and socioeconomic groups, and children, youth, and elders can all be negatively impacted by domestic violence. We also believe that early access to support lessens the risk of serious violence in an abusive relationship, and that prevention is the key to ending domestic violence. So who is making up the DV Hopeline team? So we are a completely remote team, and we have, even though we are a little over 4 years old, we have gone through 2 major restructures recently, and I will talk about both. So in 2024, in the summer, there was a need to explore alternatives to meet the evolving and growing programmatic needs. So for folks to be a little bit more familiar, the DV Hopeline is the biggest team at New Beginnings, and New Beginnings is the biggest domestic violence agency in Washington State. And so we grew a lot as a program. So we needed to explore various feedback around how to restructure to make sure advocates were supported, the community was supported, and our contacts were supported. And you all are going to be hearing the word contacts throughout today's presentation because the DV Hopeline answers calls on the phone, and we also have chat. So contacts encompasses both of those ways that folks can reach out for help. And so with the restructuring in 2024, the outcome was that there used to be a director, an assistant director, and then 2 lead advocates. That restructure happened where now there is a program director, 3 managers, and each of the 3 managers has direct reports, which are their advocates that they supervise. So we no longer have an assistant director or lead advocate role on the team. We are fully staffed, and so we have 18 advocates, and of our advocates, 10 of them are full-time. Full-time at New Beginnings is 36 hours, so our advocates work 4 9-hour shifts. And then we have 8 relief advocates. And relief advocates, they provide coverage to shifts that are open because of PTO, of from full-time advocates. Also during hours where there's a higher call volume, we add additional support to support the advocates and the callers who are calling in. And we have 3 different shifts: day, peak, and swing. So day shift is 6 a.m. to 3 p.m., peak is 10 a.m. to 7 p.m., and swing is 2 p.m. to 11 p.m. We do not have night shift advocates, and our advocates do not carry a caseload. We also have, as you got to hear, we have 3 managers, and each manager has some similar responsibilities, but they also have specific scopes of work and different tasks that can be internal and or external facing, and then 1 program director. Through this restructuring, we have already realized some of those benefits that happened, where leadership support is present for both day and swing shift advocates. Each advocate has a direct supervisor with an opportunity for regular trauma-informed supervision. There are also day and swing shift meetings, and these are spaces where advocates can share updates, debrief calls, and community build, and they happen weekly. Our on-call capacity is more sustainable and share. It used to be held by 1 position, and there's a capacity for a variety of opportunities for individual and group quality assurance, implementations for continued advocacy growth skills and learning. And there's been an increased capacity for leadership to attend community partner meetings, trainings, and outreach. And then, as I mentioned, in 2025, we went through another restructure that changed our hours of operation, that we are staffed by DVHopeline advocates. So this was effective April 1st. Up until April 1st, we did have night shift advocates. This is the messaging that we have sent out to community partners. I'm just going to share a portion of that because, as I mentioned, this did change our hours of operation. So New Beginnings had been navigating a large DVHopeline program deficit to balance the budget, and we were required to make cuts to our program. It wasn't an easy decision, but we had to, because of our night shift volume had decreased significantly, we had to eliminate staffing at the DVHopeline. We're a fully remote team, so staffing is our highest expense in our budget. And we are now forwarding our lines to the National Domestic Violence Hotline from 10 p.m. to 6 a.m. daily, so callers can still be supported with advocacy needs when they reach out to us. We entered this paid partnership with the National Domestic Violence Hotline. They started handling our calls April 1st, and then they created a designated line for us to forward our calls to them. And this helps with our reporting requirements as a program. So from May 1st to May 31st, they handled only 2 calls from the from our lines. Therefore, there was a minimal number of calls being forwarded to the National DV Hotline. The majority of our calls are received between the hours of 6 a.m. and 10 p.m., which is what we anticipated. So when a caller reaches out to the DVHopeline between the hours of 10 p.m. and 6 a.m., they will hear this message: "Thank you for contacting New Beginnings DVHopeline. If you're reaching out between 10 p.m. and 6 a.m., your call is being automatically transferred to the Domestic Violence Hotline. Advocates are available to provide crisis intervention, safety planning, education, advocacy, and referrals for survivors, as well as support for friends, family members, and others concerned about loved ones experiencing abuse. As I mentioned, we also have a chat feature. So if someone attempts to chat during the hours of 10 p.m. and 6 a.m., they will see this message in the chat box. That "Thank you for contacting the DVHopeline. Our chat hours are from 6 a.m. to 10 p.m. Please try back later to have an advocate assist you. Remember to close your browser when finished. For us, we really do value being transparent of how our services have changed and needed to evolve because of the deficit that we were navigating. We really want to make sure we're setting expectations of when folks can reach us as they develop safety plans, as they develop their network of support. And so this has been something that we have been really making sure the message gets out around we are still 24/7, but we're locally staffed 6 a.m. to 10 p.m. So one of the frequently asked questions and the things that we kind of have to demystify is the DV Hopeline a crisis and or a resource hotline? So the DV Hopeline is a county-wide domestic violence advocate line to anyone experiencing domestic or intimate partner violence, as well as concerned friends, family, community members, or those who are looking for more information or support. Even though we are county-wide, we receive calls from all over Washington State and outside of Washington State as well. Throughout this presentation, as I mentioned, you're going to be hearing the word contact, which can mean a caller or a chatter. We are an inbound contact center, which means we handle incoming calls and chats. We do not have an email address for contacts, nor a voicemail system. DV Hopeline advocates do not call contacts back, so contacts will have to reach out to the DV Hopeline again if they have questions or there is a new need that they need support around. One of the most common things that we do clarify in external facing spaces and also as callers and contacts reach out to us is that we are not a resource or a crisis line. There is times when it's appropriate where a resource referral may be given, but that's approximately 30% of the contacts that reach out to us may experience receiving and being supported by advocacy and get a resource or referral. So not every contact is going to end with a referral or a resource. Regarding mental health crises, our advocates are not mental health therapists. So we utilize other community partners such as Crisis Connection for an outbound call. So the lingo for contact center, outbound call means as an advocate still has the caller on the line, doing a warm transfer to connect them to Crisis Connection. The caller is now talking to Crisis Connection and the advocate will disconnect. And so that's an outbound call. We do not make outbound calls if we do not have a survivor on the line with us. The four major needs that are uplifted on the DV Hopeline from contacts are housing, legal, financial assistance, and mental health support. DV Hopeline advocates provide phone advocacy, and as I mentioned, they do not carry a caseload. There are times also where our managers will also provide support to the helpline. Contacts are not assigned to an advocate, and they won't be transferred to a specific advocate. So our advocates will introduce themselves, and sometimes there is even on the phone a rapport that is built. And if a contact reaches out again and says, I want to talk to Jane, and they're not talking to Jane, all of our advocates are trained to be able to support callers with their needs, and we will not transfer to a specific advocate. It will be that advocate that supports the contact in that moment. And so our contacts, the contacts that reach out to the DV Hopeline are connected with the next available advocate. Something that is unique with the DV Hopeline, many organizations have 24/7 mandates where there's advocates that are supporting their helpline, and typically it's one staff. We have multiple advocates that are supporting the DV Hopeline at a certain time. We provide both short-term and long-term advocacy, and we're going to be sharing more in later slides what that looks like for our program. We do not have funding for services within our program, so we're not able to say that we have hotel vouchers or financial support, emergency shelter screenings, bus vouchers to hand out to contacts. That is where there is an assessment around what makes most sense for eligibility, and that might end up being a resource or a referral. And we'll talk about that a little bit more. We aren't gatekeepers in the community for resources either. We don't have access to more resources and information than our community partners. One of the benefits that we do have in the community is the capacity to meet with community partners on a regular basis to get updated information around the services that they are able to provide. But unless that information is shared, we do not have any additional resources within our program itself. And also, we cannot see outside records for other agencies and also within New Beginnings. So we all use different platforms for collecting information on folks that we support. For the DV Hopeline, that is VisionLink. For other programs within New Beginnings, that's Salesforce. Hence why we're only able to see when someone reaches out to the DV Hopeline program and the interactions and engagements they've had with us. So when we think about our advocates are generalists. So they all can provide enrollment into the address confidentiality program. For folks who are unfamiliar with this is a program that does go through changes quite regularly. And so it is something that we feel very fortunate to continue to stay on top of those changes, to be able to, every advocate can provide ACP for callers who call in. We also have the ability to discern and provide assessments for domestic violence coordinated housing access points, so the DVCHAP. And then also we can assess needs for referrals to our community advocacy programs. And we'll go into more details of what that can look like as well when someone reaches out for us for support. We provide concierge service, which means we spend more time asking questions to ensure any referrals we are going to the best of our knowledge, will be a good fit in terms of eligibility and discernment, as opposed to a list of resources. When we cannot provide a direct referral, we still ensure that any referral we provide fit the caller. We spend the time to assess survivors' needs and try to match them with resources that they are eligible for. For professionals, we are also available for confidential case consults, information on domestic violence and intimate partner violence services in King County and the state of Washington, assistance with system navigation, and then also DV education and prevention information. And then lastly, for community support, knowing that folks do have the 24-hour mandate for line coverage, we are able to support folks with that. Recognizing that most agencies are continuing to experience an increase in calls, but their staffing levels have decreased. Many shelter staff are having to provide support to their agency's 24/7 line. They're overwhelmed, and agencies have been finding it hard to retain and hire staff for weekends and night hours, which can leave an agency's helpline, hotline uncovered by staff and an unsustainable workload. Also, since COVID-19, there has been a decrease in volunteers staffing hotlines and helplines, so agencies now are having to pay for that coverage of service. Also, most agencies do not have a chat feature along with their helpline. So a community partner may make the decision to forward their lines over to the DV Hopeline, and this is a deeper partnership that would be a formalized MOU, so memorandum of understanding. Because we are more robustly staffed, as I mentioned, we have more than one advocate on the lines at a time. There is also, for community partners, flexibility of the hours that they forward to our lines. It can be 24 hours, it can be after hours, it can be for a certain can be a certain period of time. We also employ many staff that are bilingual, and we have staff, our staff have access to interpreters and technology to serve non-English speaking contacts. Also, for these deeper partnership, we can contact the agency's shelter staff for things that are dealing with facilities and safety and maintenance. DV Hopeline advocates can reach out to a staff person that may be identified as being on call for emergencies. And the DV Hopeline are vision links, or a platform of things where we document anything that happens on a call. We have access to Washington 211 and also the New Day database already embedded into that system. And just to clarify, so we do have this option for MOU, but you do not have to have a formalized MOU with the DV Hopeline to utilize the DV Hopeline. We are a community resource, and anyone at any agency out in the community can reach out to us. This next section of the training, we're going to share more about how to think about the DV Hopeline as a resource of advocacy support and the advocacy that we provide.
There's a question in the chat box that says, so many of our DV clients are also mental health service recipients. How would you determine which issue is the priority?
Yeah, that's a great question. I think that this is an opportunity for all of us to share out who are presenting today. So I think it's one of those things of what are they really uplifting on the call around their DV advocacy needs, and being able to make sure that they're safe on the call as well. It can be helpful when they share information to remind them that sounds like something that you have already talked to with your mental health support. Do you feel like you're able to bring that up the next time you meet with them? So being able to, in the calls that can feel overwhelming, remind them of the resources that they have already sought out for themselves, to empower them that they do have control over being able to have multiple ways of getting support, and how we may be that support when they're not with their mental health support. Zoe or Jazz, anything you would like to add?
Yeah, I'm happy to add to that. And I think we're going to cover some of this, Lori, in a couple slides ahead. You asked how would we determine which issue is a priority, and we really focus on taking a survivor-led approach. So it's really up to the survivor to determine what they would like to focus in on during the time of that interaction. There are definitely clarifying questions that we will uplift throughout the conversation and throughout the interaction that may inform what options that we present to them or what resources that we may discuss or the type of support that we're providing. But it is truly survivor-led for them to determine what they would like to engage in and focus in on throughout that interaction.
I think the only thing I would add to that too is that with being survivor-centered, if it comes up through asking the clarifying questions, that they already have a therapist or a counselor, that we remind them that we are not in that role. Like we can provide them emotional support when they aren't meeting with their mental health professional, but we're not, like, that's outside of our scope. So we might ask questions of like, have you brought this up to your like mental health provider? Like if you have, what were some things that they brought up? Because we don't ever want to step over the work that that mental health provider is providing them as well. And there's times in the call, obviously, that maybe it's to do with domestic violence, so we can bring up the domestic or gender-based violence support and education that we have as well.
I cannot see you all, so if someone can verbally just confirm that you are able to see the next slide.
Yes.
Perfect. Thank you so much. And thanks again, Shada, for laying down the groundwork on the support that can be provided to the community through the DV Hopeline. I want to pivot us to talk a little bit about what you should tell survivors and providers in the community about the DV Hopeline and how we position ourselves to be supportive and an effective part of the support system. So there's a lot that you can share with survivors and providers in the community, but here are some of the key points that stand out for me. The DV Hopeline is a free resource to everyone in the community. Our busiest times are usually between 9 a.m. to 6 p.m. or 10 a.m. to 6 p.m. So during those hours, callers might need to wait in a queue until the next advocate is available. Since we're an inbound call center only, our advocates can't call back when someone drops out of the queue. So it's helpful to give callers a heads up so they can reach out at a time that works best for them. The DV Hopeline is not a traditional domestic violence program. As Shada mentioned, we're an advocacy support line, and we're there to fill the gap of advocacy needs in the community in support of both the survivor and our community partners' needs. We ensure consistency in care. Jumping ahead here. DV Hopeline advocates are generalists, so contacts will receive the same level of care amongst all advocates because of our effective use of systems allowing for that continuity of advocacy. The way that we ensure that continuity of advocacy is occurring is by utilizing various different Teams chat threads to communicate with others on shifts, and threads where information is carried over across shifts, so from day to peak to swing shift. We also maintain consistent standard practices in our documentation platform. So that would be VisionLink. We meet contacts where they are at when they reach out and support them in navigating their immediate needs through the duration of the call. As a contact center, the DV Hopeline does not make outbound calls unless the contact is on the line with them and we're doing that warm handoff or the warm transfer that Shada had mentioned earlier. There are a few other times when we may share information outside of our program, and that would be when advocates are making CAP electronic referrals or when completing DV CHAPs. So a CAP electronic referral allows us to gather information that naturally occurs through our interactions with the contact, with permission and consent to save that data with our CAP partners to support the next step in their journey. These referrals are how we connect survivors to other gender-based violence community advocacy programs for continued long-term support, especially when their needs go beyond what can be supported through our remote advocacy and services. Currently, we can make electronic referrals to about 12 different CAP agencies through our database system. This includes both mainstream and culturally specific programs. As Shada shared earlier, about 30% of our calls result in any resource or referral. When we are able to do an electronic referral, that is definitely something that we try and prioritize because it reduces the amount of times that a survivor has to reshare their story. One of the things that happens when we interact with a contact through the DV Hopeline is that natural dialogue is occurring where they're sharing what they're experiencing. And sometimes that doesn't carry over when they get connected to another organization. So we do our best to prioritize those electronic referrals and really tapping into those existing partnerships where possible so they're not having to reshare their story multiple times. There are always going to be clarifying questions that may come up when they are connected to a CAP partner. But if we can reduce the amount of having to just revisit that trauma, that is always something that we're looking to prioritize. One of the unique things about the DV Hopeline is that we have the time and structure to help callers move through the systems by pointing them in the right direction effectively instead of providing resource lists that increase frustration and create barriers to accessing support. So as you heard, the DV Hopeline does not offer case management support. We do not assign contacts to one advocate, nor do we provide in-person support through the DV Hopeline. And we also do not give resources or referrals for every call. We really try our best to tap into the advocacy that can be provided in the moment versus just handing them off to the next person to receive that support. So, really trying to limit the amount of cycling through resources that they are having to experience. The DV Hopeline does provide both short-term and long-term DV advocacy support. We provide as much DV advocacy as possible during each call, and we work collaboratively with each contact to ensure they are leading any next step that occurs. And we continue to support community partners by filling in the gap of services and individual agencies through the DV Hopeline. Now we're going to do a scenario. So you're an advocate at a DV agency in Kitsap County. A client you are working with relocated to King County and is in continued need of DV advocacy support. You recall the DV Hopeline as a resource. How do you share with your client what the DV Hopeline is and how DV Hopeline can support them? So with what you've learned about the DV Hopeline so far, what would your elevator pitch be when telling someone new about the DV Hopeline? Thinking back to the previous slides, what stands out that you would include in your response? We're going to go ahead and launch the whiteboard now, so you are able to provide responses there. If you happen to experience tech issues or not feeling very tech savvy today, feel free to drop them in the chat as well.
Give me one moment, folks, as I get the whiteboard to launch. So you, as I launch this whiteboard, it's going to stop sharing your screen, Jazz, and so
Okay.
you'll have to reshare when you're ready to present again.
Sounds good. Thank you for letting me know.
All right, so folks can, a little orientation to the whiteboard. There are two toolbars, the left-hand side that you can utilize to start typing what your elevator pitch would be around the DV Hopeline, and being able to use little comment boxes. You can just start typing. If this whiteboard is a new tool and you want to just focus on putting it into the chat, I can copy and paste from the chat and add it to the whiteboard if that is most helpful for folks. So we're going to take a few moments to have folks generate their ideas on this whiteboard, and we'll do a little of a share out. We're using this whiteboard since this training is being recorded. Folks won't be able to see the chat, and we want folks to be able to see what was put into the chat as they're watching this recording. So thank you so much for participating.
And feel free to share full sentences or just quick things that come to mind from the previous slides of things that you would include in your share out with a survivor or a provider.
Maybe you can read the scenario again.
Yeah, absolutely. So you're an advocate at a DV agency in Kitsap County. A client you are working with relocated to King County and is in continued need of DV advocacy support. You recall the DV Hopeline as a resource. How do you share with your client what the DV Hopeline is and how the DV Hopeline can support them? And thanks for dropping that in the chat, Zoe.
Worse. Trying to do it all at the same time is difficult.
anyone would like to unmute themselves, just give us a heads up and we can also assist with adding things to the whiteboard as well.
Okay, someone is typing, so I'm going to give a couple more minutes to wrap up and we'll review some responses, and then I'll share with you what I might uplift as a part of a DV Hopeline elevator pitch. All right, I'm going to do my best to read some of these out. Some of them are blocked by the tool, so I may not capture everything. Um, they're hidden underneath some of the tools of the whiteboard. So DV Hopeline primarily offers advocacy support, but sometimes referrals. The DV Hopeline is an advocacy resource that is free and available 24 hours a day in office, 9 a.m. to 10 p.m. Let's see, I'm going to pick up some of this, but I may not capture all of it just because it's hidden. Once again, I need some of those tools. Call the DV Hopeline if you need someone to talk to. Local line is 9 a.m. to 10 p.m. National picks up after that. When we are on a call and it is before 10 p.m., there are resources out of our area. We can give them the DV Hopeline information and let them know that the agency will be able to point them in the right direction. Hindsight, we are a small community with lack of resources. Great. Wonderful. Well, I appreciate you all for contributing. I know it's still early in the day, and some of us may or may not have had our caffeine kick in, so completely understandable. What I'm going to do is I'm going to share my screen with you all again, and I'm going to share what my DV Hopeline elevator pitch would be. So give me just a moment to navigate through all the tech once more.
And also, Zoe shared, there's also a question in the comment of someone who doesn't necessarily probably been in the domestic violence world, has a question about the meaning of advocacy support. So maybe you could check out that question too.
All right, hopefully you can see my screen. I am going to move us into what would my DV Hopeline elevator pitch be. So keep in mind, I've had some time to get really familiar with the DV Hopeline and get to the point of really being able to capture what the key points are. So feel free to take a peek at the slides when they are shared out after the presentation and kind of keep this for your reference in the future as well. So the DV Hopeline is a 24/7 inbound phone advocacy hotline for DV survivors in King County. They take calls and chats to provide you with real-time one-on-one advocacy support. If you want to connect with a local advocate, you can call or chat with them between 6 a.m. to 10 p.m. If you call between 10 p.m. to 6 a.m., the call will be answered by National DV Hotline. When you do call the DV Hopeline, they'll be able to provide you with DV advocacy for both your short-term and long-term DV advocacy needs. You can call back for support as many times as you need. You'll be able to talk to any advocate and receive the same level of care and support every time you call back. The advocates can help provide you with emotional support, safety planning, legal and housing advocacy, amongst other needs like ACP enrollment, completing applications for transitional housing, and rapid rehousing programs. Calling the DV Hopeline can be a great starting point, or it can help you address all of your needs. Would you like me to provide you with their numbers so you can get connected? that is how I would put together my elevator pitch for the DV Hopeline, just to help folks understand what support they can tap into and just knowing what information they might be able to gather when reaching out to one of our advocates and when might be the best time to connect for them. So I heard that there were some questions in the chat. I do want to wait to answer some of those until we get through a couple more slides and see if we don't already answer them through the content. But if not, we'll definitely circle back to the questions in the chat closer to the end of our presentation as well. So now I'm going to hand it off to Zoe to guide us through another activity.
Thanks, Jazz. Gonna figure out where all my buttons are. Awesome. Perfect. Let's see. Are you guys all? I can't see anything. Okay,
Yeah.
perfect. Awesome. So our next scenario is going into a fictional audio with a survivor and an advocate from the DV Hopeline. I will be sharing that audio, and I'll be pausing after the survivor or the fictional survivor. You'll recognize the voice because the survivor is me. And we'll be pausing, and the question kind of throughout is if you were a DV Hopeline advocate, what input would you specifically say to the survivor? Just so we can hear other perspectives. And then I'll press play again, and then you'll hear the DV Hopeline advocate respond to the survivor. It's for your input to be heard from us. If you want to just uplift that in the chat, you can always unmute yourself too, if you prefer that over chat. So I'll share that audio. Oh. Let me stop sharing really fast so I can make sure you guys have sound. All right. And there's no ringing, but the phone is ringing. What would you say if you're a DV Hopeline advocate once you answer the phone? And like I said, please put in your comments in the chat.
Zoe, we can see the transcript also to the right-hand side with the window screening that you have right now.
Oh, okay. That's good to know. That's it. I'm giving you guys all my answers. And I can't see the chat, so if anyone, Jazz, Shada, whoever would like to read things off, I'll give like 1 minute for people to type in their greeting or their introduction to what they would say when they answer the phone.
So this is a section of the training where it is a more engagement from you all. And so being able to hear the various ways that you all bring in your experience and your skills into this training, we're trying to view this as remote advocacy. So being able, if you're more of a in-person traditional organization, of being able to think about how are you going to transfer those skill sets when someone cannot see you and is highly reliant on the things that you say.
It's like when we get calls in the middle of the night and we're answering them, we just answer like crisis support network and then kind of have like a nice tone because if you answer it like oh rah, they kind of scare off too. So you just kind of have to not be all like cheerful but nice enough to be welcoming.
Mm,
So
Thank you,
Thank you for
Melissa.
that.
Yeah, and Zoe, I'm going to read some things from the chat.
Okay.
DV Hopeline, how can I help you? And so far, that's what we have in the chat.
Perfect. I'm gonna play it. If you guys can't hear the audio, please just let me know. It'll be a couple seconds.
For calling domestic violence helpline. Calls may be monitored for quality.
Did you hear that?
We did. It was a little muffled. Can you turn the volume up a little? Oh, it's at the highest. Okay.
Yeah. Let me see if on my computer screen.
Thank you all for your patience as we navigate this.
Maybe I'll slow it down. And that helps. This is not how the advocate sounds.
Calling domestic violence helpline. Calls may be monitored for quality.
I can't hear it.
Oh man. Okay. Let's see.
Maybe you can just say it.
Yeah, no, that's true. It's okay, perfect. Let's not do that one. Maybe Shada, would you be able to try to share to see if I don't
How about if you stop sharing your screen, Zoe, and then if you would you mind just saying what your transcript says?
yeah. No, I can definitely do that.
Thank you.
It's not as exciting because you just hear my voice over and over. So what our advocate would say once they answer the phone is, thank you for calling the Domestic Violence Hopeline. Calls may be monitored for quality and training purposes. Is it safe for you to speak right now? So one of the things our advocate does is we managers, we monitor calls. We never record them. So advocates we call it quality assurance. They say from the beginning that calls can be monitored for quality and training purposes, just for the survivor to have autonomy of if they want to continue the conversation, if they don't want their call to be monitored. And then we highlight who we are and we check for safety. So that's what the advocate would do once they answer the call. And then the survivor says, yes, I'm currently safe. And then the advocate, once the advocate says that, what would you say if you were answering this phone as a DV Hopeline advocate?
I'd say probably ask them, is everything okay? Because they're calling for a reason. So they're so I'm trying to think like when people call in the morning or call in the evening, hey, what's going on? Just kind of opening it's just like when a client comes in, but it's like on the phone. And so it's just, you have to, it's your mannerisms with your words, and you're not trying to rush them to talk to you, but being patient enough to let them open up and share what they can at that moment.
Yeah. Oh, that's really great. I mean, I'm just going to go with it, but that's exactly what Melissa, or the advocate, would say, is that she goes into, how can I help you? Because you don't know anything about the situation. They're calling, they're currently safe. That's all you got. So how can I help you to get the survivor to start talking a little bit more about what's going on? And then the survivor, or at this part, you don't even know if it's a survivor. So I'm saying that because I know it's a survivor because I created this. But it's really a contact because it could be any type of call that's coming in. And they go into their story once the advocate opens it up with, how can I help you? And for this scenario, the survivor goes into, I'm in an abusive relationship with my partner. We've been together for about 5 years and lived together, and I just don't know what to do. Things are getting a lot worse, and he definitely doesn't know that I'm calling you guys right now. I'm in my car in Seattle, and I think I'm ready to leave this relationship. So after you're saying this, how, as an advocate, would you respond?
We have a few things in the chat too, and I want to just uplift that folks are saying, do you want to tell me a little bit more what's going on or what brought you to the DV Hopeline? Also, there is, okay, glad to hear you're safe. How can I support you at this time? And then also, we are going to have a pivot to have a break at 10:55. Dee, how many minutes is that break?
Oh, about 5 minutes.
5 minutes? Okay, perfect. We will be mindful of the time. Thank you. So things are coming up in the chat. Oh, there's a question. To Lillian's question, yes, there's times when folks may not have be given resources or referrals. Zoe, do you mind repeating that last section since I read some things from the chat?
Yeah, of course. I am in an abusive relationship with my partner. We've been together for about 5 years and we live together. I don't really know what to do. Things are getting a lot worse. He definitely doesn't know that I'm calling you guys, and I'm currently in my car in Seattle. I think I'm ready to leave the relationship. I'm trying to do the Spark Notes version of like the call too.
I don't want to be that person that talks all the time, but you could probably,
No, it's great.
okay, you probably ask, be like, you know, are you looking for a shelter? Are you looking for a safe place to stay? Or the other route is, do you have a safe place to stay? You know, like just kind of throwing that out there, opening the dialogue.
No, that's great. That's the advocate in the scenario went, so it sounds like you guys currently live together. Do you currently have concerns around your safety as far as his behavior? How is he getting more aggressive? So trying to gauge on kind of what's going on in that situation. And then the survivor responded with saying, we currently live together and we have 2 kids together. And then it goes into, he's always been this way by calling me names and things like that since we got together. But I always just wrote it off because he just doesn't know how to communicate very well. But it started escalating or getting worse in the last couple of years since we had our last child 2 years ago. He's a little bit more handsy. He's been shoving me. Last night was one of the worst situations where we got into an argument when I came home because I missed his phone call and he pushed me into the wall and I hit my head. And now I have bruises all over me from that situation. And when I came into work today, people started asking questions about what's happening. Since people are asking me questions, I'm realizing that it's now not just in my head or me, but that I just don't want to be in this relationship anymore. And then with that, I know it's a lot of information, but if you were the advocate, how would you start to navigate
I think
this
these were
call with
great
the
comments
survivor?
in the comment section. I really like some of these answers and just how folks are saying reaching out for support. So thank you for telling me about that. So you're actually saying, thank you for sharing with me and reaching out for support. Do you have any immediate concerns? I think that is so important because you're asking, is there anything that's happening immediately? Um, and then what form of support do you have, if any? Like I just think those are great questions to ask. I really like that someone said, I'm sorry you're going through this right now. You're acknowledging that that situation is challenging. I think that's awesome to start off with that. And just recognizing that it takes courage for them to call. And I like that someone said, what would you need? Or what you could ask, like, what is your immediate need? What in the best of best, what could we do to help you? What would that look like? And I say that because I really want to make sure that I'm allowing the individual to create the vision of what they want, not me as an advocate determine what I think they need. So that's just my thought.
No, I think that's great. And that's, I mean, that's the heart of advocacy. I know there was another question about advocacy early on, but that's the heart of it, of being able to, like, people are giving us this information. They never met us before. Maybe they've called before and they might heard our voice, but maybe not. And they're letting us see into their world when they've had a lot of shame and just wanting to believe it's not true. And being able to walk alongside them by asking those type of questions, but also acknowledging their journey and what they've already been through, and the resilience that they've already had through the situations that they're going through. So I appreciate that, and uplifting some of those things in the chat as well.
I might ask how, what kind of support they have. I think that was mentioned. And then I would also just be curious to initiate that conversation of like, what does the timeline look like for you? By when would you like to leave? And then working backwards from then, what are the steps that might be helpful? Like, I would say to the survivor, ask if they have what do their finances look like? Do they have their own bank account? Do they have their own way to secure their finances? Do they feel like they have safe avenues of communication in terms of texting and emails, or do they feel like those are being monitored or could be? And so just starting to work backwards with the survivor, mentioning, if they share children together, that, wow, it sounds like it would be helpful for you to eventually talk to a legal advocate so you can think about a parenting plan. Where do you want to end up? Like, do you want to leave the state or do you want to stay here? Oh, I understand your kids go to school here. Okay, so what does that look like? Do you have an income? If so, just trying to sort through the logistics, because all of those things, if the survivor has a bandwidth, it's like, oh, right, okay, these are the pieces. So I think a big part of advocacy is like helping someone lay out all of their pieces, their cards on the table, and just sort of like, looking at them together in a way that isn't charged, but just sort of neutral. Like, this is what it will take, and this is about how long these things might take. And I'm really big into setting realistic expectations too. So, like, okay, if you need to flee tonight, great. But otherwise, I talk to my clients about safer planning. So, in advocacy, in this advocacy world, we call safer planning. It's like, how can you stay safe while you're still in this relationship and making a plan to get to ultimate safety, which is to leave the relationship. So, in the meantime, what does that look like for you? And I think those things can be supportive to just be able to be that wall that the ideas can be bounced against, and to maybe think of some things that the survivor isn't really necessarily thinking about. It's always nice when there's a little bit of a runway, to start to put together an exit strategy. That's always better than I just left and now what? And I need a place to stay tonight. Those are the tricky ones.
Yeah, no, that's very true. I know we need a break. Do you, Shada, just want me to wrap up a little bit of like what we did on this call, so then we start in the next
We
area?
can go
Or
ahead and
do we want to
continue
come
with the,
back?
we can continue with the call, but let's go ahead and break. And so if folks can come back at 11:05, we will see everyone then. Thank you everyone for the things in the chat and for unmuting yourself and engaging. We'll come back to this call.
We're gonna take a 10-minute break, so if, not a 5, a 10-minute break, that's what they need, so just take 10 minutes from here.
All right, see everyone at 11:10.
Okay.
Just want to get a gauge since it's 11:10. I know breaks go by really quickly. If we can get some thumbs up, some emojis in the squares as folks are trickling back in, so we can kind of get a gauge on all who are back. Thank you for folks who are using the reaction buttons, putting emojis in the chat. Really appreciate it. It seems like folks are returning. Zoe, if you want to return back to our scenario.
Yes. Trying to imagine where we left off. So we left off with the survivor telling her story, people responding, definitely providing like emotional support and validation. So I'm going to go into what the advocate at the DVHopeline responded with, and then I'll take a pause and see what you guys would do next. So the advocate at the DVHopeline, thank you for sharing and for taking the time to contact us. It sounds like you're holding a lot by yourself. However, it does sound like you're ready to leave the relationship. Is that correct? The survivor responded, yes, I'm definitely ready to leave. And then the advocate responds with, what does safety look like for you in leaving? And then the survivor responds with, sorry, I lost my spot. There we go. Safety, that's a great question. I'm not really sure. I know that it would be best if I didn't have contact with him. Thankfully, I do work full time, so I can pay for our apartment on my own. I don't really know what the options are. And if you were a DVHopeline advocate, how would you respond?
I would ask her if she feels safe staying in the apartment. Or does she need assistance with moving? And let her know that there's options for rapid rehousing or direct assistance with help for moving.
Oh, yeah, thanks, Trina. Oh, that is really great. And that's what the advocate kind of goes in next of. It sounds like you're looking into some options. A couple options, if you are interested in housing, could be looking at relocating if you don't feel safe in your apartment. Or there's also a domestic violence protection order, where you can apply for yourself as well as your children can be placed onto it. Sorry, the script is always hard. However, protection orders might not be the safest for everyone, because it depends on your partner. If he doesn't care about law enforcement or legality, it could create for you to be more unsafe. But that could be an option if you feel like he would respect a court order. And then the survivor responds with, those are good options. Right now, I feel safe staying in my apartment as long as he can't be there. So I would be interested in looking at what a protection order is and what that could provide me. And how would you respond if you're an advocate at the DVHopeline?
I'm going to jump in with what I would respond with, even though I do work at the DV Hopeline. Maybe it'll get the ball rolling. A couple things that come to mind for me are I want to make sure that she's what county she's in, because different counties have different processes. And so I want to be mindful of the information that I'm sharing with her aligns with where she's located. And I'd also want to check on technology access before really jumping into like the next part of our conversation.
I might offer just an outline of how the protection order process works, painting a realistic expectation of the timeline, and just sort of give her the overview. Like, you first fill out this, you petition the judge hears you, and then if you get awarded a temporary order, he is then served. That can take up to this amount of time. It's a separate unit. And then during that time, once he is served, the order is in effect. And then you go back, just kind of walking through, because I mean, people, if they've never done it before, don't know anything about that. Also, it's not like a one-page application. It's not like you just petition and it's stamped with approval. It's like, to just talk a little bit about the statement and the what goes into it, and when a commissioner is looking at it, what they're sort of looking for and why it is that you're saying you need protection from the courts. So sometimes I think it's just nice to like walk everybody through what that actually looks like in terms of timing, but also in terms of the output. It's not like, I mean, ideally those statements you put a little thought into them, and that can take a little while.
Yeah.
I'm going to share what's posted in chat too before you move forward, Zoe. Someone shared very similar to Nin that they would not assume that the survivor knows what a DVPO is and what it entails. And they would describe to the survivor what a protection order is, what it does, and the process to get one.
Yeah. No, that's great. That's exactly what this advocate did as well. So they highlighted of that it's out with being in Seattle, you can apply for a domestic violence protection order within King County through the court's office. If that's something you want to go into, we can talk more, or it sounds like that's something you want to go into. Just a reminder that a protection order can be with you. You can include your children. And if there's no sort of parenting plan, then it can help maintain that, like the kids don't go with him until you have a parenting plan in place. Since if you guys both, or because of right now in Washington State, you guys both have legal rights if there's no parenting plan. And then she goes into detail about the protection order. So it can protect you. When you first apply, there's a lot of paperwork to complete. And she goes into the King County process. I don't know if I'm going to speak about everything she highlights, but in King County, you can do it virtually. And our advocates at the DV Hopeline were trained on domestic violence protection orders and the process and how to apply for them and how to walk through with survivors on how to basically petition or to create the petition for a hearing. And the advocate goes into when she completes that, if she wants she could do that on her own, or she could work with the domestic violence protection order advocacy program, depending on what she's comfortable with. And if she does it on her own, there's always a box that she can check that at any point in the process in King County that she can work with a domestic violence protection order advocate that's through the court, and that they can help look over paperwork even after she files for the temporary, to help collect and organize her evidence or prepare for the hearing. They can help her in the hearing process. And the advocate walked through like all of those steps with her. for the caller and just highlighted the different things to think about. And then she ended with saying that it's up to you in your comfort area. So would you prefer to start walking through it together, doing it online? Or would you prefer to connect with a domestic violence protection order advocate? And then the survivor responds, oh, sorry.
Yes.
The survivor just responds by giving their answers, and we ask more clarifying questions. And we always end our calls, just because I know we're kind of going into deeper, that just reminding them that we are 24/7. They can call us at the DV Hopeline between 6 a.m. and 10 p.m. to reach any of our advocates. If they call again, they won't necessarily get connected with that same advocate, but we could save their information in our system. So any advocate she reaches with can basically pick up where they left off and then provide the same amount of support with whatever next happens. So this call specifically, we started talking about parenting plans, but she wasn't ready for it and things like that. So we kind of do that as a reminder in wrapping up the call.
Thank you. And I think there was a few more comments in the chat. I'd also check in with her regarding the possibility of an order not being given and what she might be able to do, because I don't know exactly what is going on if she qualifies. I assume she does, but would want her to be prepared and have alternative safety options. Another comment was, I would also make sure to let her know he will get to read everything she puts in the order and see how she feels he might react to being served the order. And furthermore, I would try to safety plan with her around how she feels he might react and safety plan with her around him being served as well.
That is great. That's something I didn't touch. If this was working, you guys would hear all of those things too. So part of it, this call too, was safety planning around or informing her about the serving process, and then safety planning around, is there somewhere you could go, maybe for a week to up to 2 weeks until he's served, so you're not in the home together. And then once he's served, how to safely get back to the apartment and change locks and different things like that. And another part, also uplifting, Trina, what you said is like safety planning around, if he reads everything, would you be comfortable with that? Especially because they have kids, so it's not going to be, you're never going to see this person again. Even if they didn't have kids, that's not always the case. So being able to safety plan around those processes too, and what that looks like. This scenario that me and an actual DV Hopeline advocate did together was a 20-minute conversation. And that's with the scenario. So this call probably would be anywhere from like 45 minutes to maybe even an hour and a half, just depending on where the caller is going and kind of like the support they're needing throughout that process. And this call didn't end up, we didn't refer her anywhere besides helping navigate to the King County website where she can virtually fill out and file paperwork for a domestic violence protection order. So we didn't have to connect her with, like, at this time, she didn't need ongoing legal advocacy with another agency, or she wasn't ready to get connected with a community advocate or community advocacy program. She didn't need housing. So it was all support that we could provide as advocates on the DV Hopeline.
Thank you, Zoe. Thank you, everyone, for your patience too. We never know sometimes how things are going to function in this virtual space. And one of the things, along with the slide deck that we'll be sharing, is the whole transcript of the call for you to go back and review and see some of the different aspects we didn't cover in the presentation today. So thank you all for engaging, for listening, for the work that you're doing as well. We can tell definitely the strengths of advocates in the community. And thanks again. And we're going to jump back into our presentation.
Which will be me again. So now we're going to go into defining remote advocacy for the DVHopeline. So now that you've had a chance to hear about the domestic violence Hopeline, what we do, and listening to, well, hearing me talk through the fictional survivor and advocate call, we're going to be sharing like actual steps on how we do it. Remote advocacy at the DVHopeline is defined by these 3 pillars of remote advocacy, which are boundaries, safety, and confidentiality, survivor-centered and trauma-informed approach, and ensuring accessibility and equity. So the first pillar is boundaries, safety, and confidentiality. So at the DVHopeline, advocates play a vital role in our system of support. At the core, we're emotionally supportive, present, and active listeners. When someone reaches out, whether by phone or by chat, we hold space for them. That means we create a calm, compassionate environment where their safety, dignity, and agency come first. An example of this is in safety planning, because it should feel collaborative, not forced upon, or we're telling them what to do as part of their safety plan. So we use a lot of language such as, would it feel helpful to talk through ways to stay safe? What has worked in the past when you felt unsafe? This just keeps the survivor in control while still offering support and ideas along the way. We're also trained to skillfully de-escalate high emotional situations and help ground callers, especially those who may be in a crisis. Our immediate focus is always the safety and well-being of the caller, and we were trained to navigate that while remaining present and supportive throughout the contact. Every interaction starts with a proactive safety assessment. This includes both physical and digital safety. We ask about their current environment and address any concerns around tech safety. So tech safety is part of every contact we have. We prioritize safety by checking for privacy and offering options to our contacts like aliases, so they don't have to give us their actual name or personal identifying information. We safety plan around safety codes. So if a person causing harm ends up showing back at home unexpectedly or walking into the room, anything like that, they can say the safety code and we immediately know to disconnect the call. We provide non-identifying communication, like I said earlier, we ask for zip codes just so we can best support them, since every city and county is different, but it's not an obligation that they have to provide that to us. And we always ask for consent before saving or documenting any identifying information. And if they choose not to share, like I said before, that's completely okay. These steps just allow survivors to be empowered and to reduce the risks, especially in cases where devices may be monitored or compromised. We also respect caller preferences, whether they want to remain anonymous or use indirect communication. Some folks may prefer not to share their name, like I said before, or may use coded language, and that's okay. We honor that. We mirror, as I'll say later in this, what the caller is telling us and what they're going through. And we also take time to establish clear expectations. So what does confidentiality look like on our team and what they can expect from us? We let them know. One example is on a chat from the very beginning. They know that we're mandated reporters because that's part of our role as advocates. And how we open a conversation matters because every introduction on the DVHopeline should include a quality assurance statement. You heard that from the scenario. An example of this is this call may be monitored for training and quality assurance purposes. Then we greet them warmly of, this is the Domestic Violence Hopeline, how can I help you? And then we immediately follow by a safety check to assess their current environment. So are you in a safe place to talk or type right now? This sets the tone for a supportive, confidential interaction and gives the caller the opportunity to share any immediate concerns. Also, a DV Hopeline advocate moves at the pace of the survivor. This means we're creating a judgment-free space, staying calm, and giving them control. And we'll ask open-ended questions to best support the contact without the pressure that they have to answer the questions that we ask. So would it be okay if I asked more about what's been happening? What does feeling safe look like for you today? This communicates respect and centers the caller's autonomy. And we also compensate for the lack of visual cues by using warm or verbal warmth, empathy, and vocal presence. And we mirror the caller's language, not only to build rapport, but also to affirm their reality and minimize any perceived power imbalances. And an example of the last basically bullet point that we talked about are some of the compassionate techniques through empathy, warmth, presence. I also included some other ones of reflective language and silence. These are some examples of what we would say, and they're meant to be supporting the caller throughout the conversation at the DV Hopeline, because our goal is to show up for survivors in any way, in ways that are trauma-informed, empowering, and emotionally safe. These techniques are not all encompassing, but they share the phrases that our advocates utilize to build rapport throughout the phone or chat conversation. And they just help us meet survivors exactly where they're at, and creating safety for them, for contacts to feel like they can show up fully what they're going through and who they are. So since we can't rely on facial expression or body language, our words really carry the weight. And a part of this is through empathy. Some of this, as the examples on the screen are, that sounds like you're going through a lot. It's okay to feel that way. This is a safe place. Some examples of warmth are, I'm really glad you reached out today. There's no pressure. We're here to support you. There's no rush. Would it be helpful if we took a few deep breaths together? And we communicate presence with reassurances, such as take your time. We can pause and come back to anything. You're not alone in this moment. All of these combine to create emotionally safe, especially in the absence of visual cues. And continuing to build rapport from the moment we say hello, we build it through consistency and active verbal affirmations. Some examples of this are just letting them know while they're telling their story. Sometimes right off the bat, it's like 10 minutes of them just talking through their story. And we just want to keep acknowledging that we're here, we're listening with them. And we can pause them sometimes of, oh, I'm confused by what you meant by this. But some examples of that makes sense, just saying, I hear you, take your time, I'm here. And we also use reflective language throughout this time and throughout the call by saying things like, what I'm hearing is that you've had to carry so much alone. You've been surviving under really difficult circumstances. These statements don't fix things, but they offer validation, which can be incredibly healing for a lot of our contacts. And finally, there is silence. This happens a lot on calls, and silence can feel incredibly uncomfortable for a lot of people, including advocates. But in the DV Hopeline, it works. It's often a necessary part of our work and very supportive, because it allows space for reflection and avoiding rushing the contact. We can gently normalize silence by saying, you don't have to fill the space. This time is yours. And in moments of silent or quiet or silence, we stay present. That present can be felt through tone, timing, and intention, and it reminds the caller they're not alone even in stillness. And just a reminder, compassionate advocacy isn't about fixing. It's about showing up fully, listening deeply, and helping survivors reclaim a sense of control. Even small choices in how we speak and respond can be incredibly empowering for the caller. Let's see. And here is a reflection question that we can share, like I said, verbally or in the chat. Now that we've reviewed boundaries, safety, and confidentiality, how do we see advocates applying these in their own roles? Or how do you see?
Well, this is Deidre. I think one thing I'll just say is that I think so much of this is important. But one of the things that I find that's really important is that each advocate is doing a similar thing. It's so important that we're all not doing different techniques when we're answering the calls. So it's important to, like, for example, take this information and practice with your other advocates, or teach new advocates by shadowing how to interact with callers over the phone. I have come to learn that many programs, because there's turnover, new advocates start and they're kind of like at a loss of what to say or what to do because, everyone is so busy. So these are great tips and tools so that we can all be on the same page when we're responding to callers in our programs, when we're checking in with our callers, when we're talking to them. We're all on the same page using somewhat of the same tools. I think that's so important. And one other thing I will add is keep in mind, it's not your story, it's their story. I know sometimes we can relate to callers and their story might sound like your story, but it's not about you as an advocate, it's about the caller. I know sometimes we want to share information, but just keep in mind that should be limited, and that should not go on about yourself. It should be really focused on the participant.
I was gonna say a couple months ago, we had an advocate meeting and we discussed on call and having empathy when people call and stuff. It was really funny because like when you're asking these questions, that's pretty much how we were. We were like, because it's like the on spot. Okay, what would you do? And instead of getting a space, when you're in the moment, it's you can do it just like when clients come in, you just do it. It's part of what we do. But then when it comes to you asking us questions, or for me, I was like, but yeah, so I really appreciate it. I took lots of notes, and I like that you guys are going to be giving out slides. So this is some great information to share with the other advocates. So thank you guys.
No, I appreciate that. And that's what, it goes into our response to this for advocates, framing boundaries, confidentiality, and safety for advocates themselves. Part of this, I'll go into it, but every advocate is given the opportunity on the DVHopeline to have their own alias for their own safety and privacy. A good example of this, in my opinion, we have relief advocates, and some of them work at other DV agencies. So to make sure that they have their own safety and privacy, since they kind of are in two different spheres, is to have an alias, just so people can't identify them in their other workplace, so they can feel like both areas are separated. We also require that all advocates on the DVHopeline have confidential, quiet workplaces. So a room where family members can't come in and out or hear conversations that are happening. And then advocates also have weekly team shift meetings with peers and supervisors. So this is a space that's, I think Shada brought this up in the beginning, but is collaborative. It's supposed to be team building. We go over some times trainings together and different things like that. So it kind of just depends on what the advocates are needing and what they're wanting. And as supervisors, we let them lead these spaces a lot of the time. And then we also have weekly or biweekly individual supervision, just depending on the advocate and their needs as well, and what they prefer in supervision. Another great thing for the DV Hopeline is advocates have predictable roles and responsibilities. This really creates a good work-life balance. They don't have case loads. Once they clock out of their shift, they're not expected to clock back into their shift to check emails or anything like that. So there is a true separation between work and life in those instances. And another thing that we create boundaries and call management tools depending on certain type of callers or situations that might come up. So a couple of these are different boundaries that advocates might utilize. It's not for every contact for sure, just specific ones. The first one is when it's a non-DV need arises, we validate and say a sentence similar to this is, I hear you're going through a lot. Are there any needs that are DV related that I can help you with right now? Just to really ground in the needs of what that caller contact needs. And if it's not DV related, then we can point them to the best non-domestic violence resource, since we're gender-based violence specifically. And then the other example is when callers are just escalated, saying a statement that it's similar to, I hear you're holding a lot right now. It might not be the best time to talk, or saying there should be a little bit more quotes in here, or asking them of maybe we can take a few deep breaths together. And if that doesn't work, then we can ask if they would just want to call us back whenever they're ready, because we are here for them. This just helps ground the caller and making sure that the advocate and the contact is supported throughout the conversation. And then the last one is when the advocate is being harmed or verbally abused by a contact. They can say statements that is similar to this is, I want to support you, but I cannot continue if I'm being spoken to in this way. Please call back when we can have a respectful conversation. And then they'll go into like our hours and they can call back during these times. But this is really to support advocates through calls that are like that. And then also the contact to just let them be aware of how they're showing up. We obviously don't jump to this, but these are just examples of if callers are escalated in these types of ways. And I'm going to stop sharing and it's going to be Jazz's turn. And Jazz will be talking about our second pillar of advocacy at the DV Hopeline.
Perfect. If I can just have someone confirm verbally that you are able to see my slides.
Yes.
Yeah,
Perfect.
I can see it.
Thank you. All right. Well, now that we've explored some boundaries, safety and confidentiality, along with those compassionate techniques that shape how we show up for survivors, I want us to move into looking at our second and third pillar. So second being survivor-centered and trauma-informed advocacy approach, not just in theory, but how we at the DV Hopeline anchor this into our day-to-day work. So the DV Hopeline isn't just a helpline. It's a remote advocacy program that's rooted in responsiveness, flexibility, and survivor-defined support. We are partners in the empowerment of survivors by walking alongside them and not ahead of them. We are staffed with emotionally present and attuned advocates who focus on self-determination and care over problem solving or crisis management to fix the problem. Our advocates are skilled in offering support without preconceived assumptions and in creating space for survivors to name what healing, safety, and justice means for them. I think this really ties back into, for a lot of us who are doing this work, we hear about active listening. We do a lot of trainings on active listening as well. And this is really a time where you are listening to listen and not listening to respond. So we really try and root ourselves in that framework as well. DVHopeline advocates will allow contacts to lead the discussion and define what matters most by asking clarifying questions. An example of this would be asking something like, what feels most important to talk about right now? Is there something is there something you're hoping to get support with today? Would it feel helpful for me to offer options, or would you prefer just to talk right now? And this could lead to clearer understanding of their needs and next step. So tying that back into the scenario that Zoe was leading us through, every call is going to be different. Whether we are able to navigate some of those DVPO needs over the phone or whether we're directing them to a resource, it's really going to depend on what the caller or the contact is able to take in that moment. Maybe it's just information downloading. Maybe it is actually walking through step by step how to set up a POP portal through the King County website and move through the initial pages of the petition, or just start thinking of what things to include as evidence for a DVPO, or what things that you may want to include as part of your petition when writing out those incidents. So there's a lot that can be done in that space as well. Advocates will always ensure the contact is aware that every option presented to them is rooted in consent and not pressure. So we may say something like, I'm glad you felt comfortable to share what you have been navigating with me. I know it can be very overwhelming to determine what to do next. Would it be helpful to you if we go over some possible options for you to consider as your next step? Great. I heard you name a few different areas where you may be needing support, like figuring out how to get into a transitional housing program, or figuring out how to access mental health services that are specifically for someone who's been through DV. Is there one thing that you would like to discuss first? Asking these questions ensures that we're bringing them along and allowing our contacts to make informed decisions and not trying to fix the problem by telling them what they should do next. So again, going back to earlier when I mentioned that it really is a survivor-led conversation. Our advocates will always meet contacts with compassion and not correction by affirming that their response to their abuse is valid. We normalize breaks, silence, and emotional responses by modeling patience and consent throughout the conversation. Silences and emotional responses are normal in these situations. We want to make sure that the caller understands that a heightened state of emotions or needing to pause does not mean that we can't continue to move through the call or that we can't provide support. Something that you might hear a DVHopeline advocate say is, I understand that this is difficult to talk about. If you need to take a break at any time, we can always pause. You can place yourself on mute and go ahead and unmute when when you're ready to continue. They may also say something like, I'm hearing how difficult this is for you to revisit. Are you still feeling safe and comfortable to continue? You can always call back and we can pick up where you left off when you're ready. So really just normalizing that it's okay for callers to, have emotions, be crying, be frustrated, get angry over the phone, and to not know what to say. I don't know where to start is something that we hear really commonly, right? So it's okay to have those moments. How can we support you in moving through that, and knowing that just because you're not sure how to move through that space doesn't mean that the support is no longer available to you. So our last and final pillar with how we move through remote advocacy at the DVHopeline. We've grounded ourselves in how DVHopeline advocates show up with compassion, consent, and a commitment to centering survivors. I'm going to talk to you now about who we are supporting and how we adapt our advocacy to truly meet people where they are. DVHopeline advocates work with contacts who've been historically excluded or underserved by traditional systems due to the impacts of systemic oppression. We are intentional about removing barriers and shifting our approach based on each caller's unique needs and lived experiences by skillfully adapting how we communicate, to how we provide empowerment-based safety planning, to how we support survivors without requiring them to prove their trauma or to prove that they're a survivor. Our advocates will always prioritize the best form of communication during that time of contact, which could be phone or chat. It can also look like checking in to see how much time do you have to talk with me right now. So we can be mindful of what things to share and how deep to go into a certain area, and just temperature check of how much information would you like right now that will be helpful to you in this moment. We collaborate with interpreters through the use of language lines to ensure contacts are feeling seen and represented through the duration of the contact, and we'll use plain language and respect cultural identities. DVHopeline advocates also use a harm reduction framework that focuses on meeting people where they are and not where we think they should be. Rather than requiring someone to meet a certain threshold or follow a rigid process to receive support, we really try and focus on what's possible and what's helpful right now in the moment of our interaction. For DVHopeline advocates, that means offering support that reduces the immediate harm, and it honors each contact's choices and doesn't require them to be in crisis or ready to leave in order to receive care from our advocates. We will provide support options with consent and context to center the contact's agency and autonomy. So we might create an opportunity to consent by asking something like, I hear you sharing how difficult it has been to be in this relationship and not have any existing support systems. Would you like to explore together what safe supportive spaces you can engage with in the community, like support groups? Or we can say something like, I'm hearing you share how hard it has been to make ends meet, but you are needing to set up security cameras around your home. While as a DVHopeline advocate, I cannot provide you with financial assistance, I can help you connect with programs who can support you with this need. Would you like to discuss this as an option so you know what to expect, how information is shared before deciding if that's a support that you want to tap into? So it's that piece of not only making sure that there's an opportunity to consent, but to bring them along before you even get to the stage of moving through what those resources could be. Really understanding what is happening on the back end on our side before we're able to connect them with a different resource. So now that we've looked at the final two pillars that guide our remote advocacy, reducing barriers, adapting to individual needs, and honoring survivor agency, I want to uplift just some of the phrasing that you heard me share in those earlier slides and what that sounds like in conversation. The slide is really just highlighting the examples of how our DVHopeline advocates put these values into practice through our words and tone. You heard how we offer options, center consent, and check in on emotional safety, and let the survivor lead at every step. Although you heard me share scripts and saw me reading a script, they aren't scripts when our advocates are on the call. They are flexible tools to help us build connection, clarity, and trust in each interaction. It's kind of going back to the core of what we learned in our 40-hour DV training of power and control, and giving survivors back that power to decide what they want to do for the situation that they are navigating. And again, how do we walk alongside them, not ahead of them through that process? So now we're going to move into our final slide. At the DVHopeline, all advocates and leadership are mandated reporters. And so he's going to walk you through how this responsibility applies to our work at the DVHopeline. Oh, you're muted.
That's an important thing to know. At the DVHopeline, mandated reporting comes up often enough that it becomes a muscle memory for a lot of our advocates that we have to work and keep working on. Most of us didn't come into this work to file reports. We came in to support people So when a mandated report situation arises, it can trigger a lot of feelings for advocates, as well as the contact. Some of that includes fear, worry about what might happen if we don't report, or about if we do report, or even what might come up if we ask a hard question and get an answer that requires action. So at the DVHopeline, we're mandated reporters under the RCW in Washington State. That means we're legally required to report when we have reasonable cause to believe that child abuse or neglect has occurred. And we always inform callers and chatters of this responsibility early in our conversation, or when information is starting to come up that we think might lead to mandated reporting, just so that our contacts are aware. We support families is our main thing by navigating these incredibly complex systems, and it's often really painful situations. This support includes listening without judgment, offering resources, validating their experience, and we also provide parenting support as well. We ask clarifying questions, not to interrogate them, but to understand the situation fully, because this helps ensure that if a report is made, it's informed and grounded in what the caller is actually sharing. And we always want to empower the caller or chatter to make their own report. We know there's value in the individual having agency in this process, and sometimes their voice isn't what's is what's needed most. There's also the ethical tension that we have of we're asked to submit a report because we have to, even when someone else, like a therapist, a family member, another advocate, or a long-term time provider, might be in a better position to do so because they know the individual or family more deeply. And that's where the advocate role becomes so powerful, because we can support a caller in creating their own safety plan around making a report. That might mean helping them find the words, figuring out the best time, or understanding what happens next. And we also consult with, or advocates consult with supervisors and our program leadership when there's a question about whether a report is necessary, or if it's seeming that the call is going towards a report needing to be made, because we don't want to make these decisions in isolation, or have our own biases play into the reporting process. Some of the things about mandated reporting that we don't do at the DVHopeline, and we've said it multiple times, but we don't provide ongoing support as in individualized case management style ongoing support. So after a report is made, we're the advocacy line, not a long-time service provider or case manager. So we really make that clear to contacts if a report is needing to be made, to make sure that they're connected with either ongoing support if that's something they're needing, or that they can call us back at any time, but they might not get that same advocate again on the line. We also don't report just because something feels uncertain. We report only when we have reasonable cause to believe abuse or neglect has occurred. And that's a really important distinction. And we also don't work for DCYF or APS or act as investigators. It's not our role, so we're really clear on these boundaries, that if they're needing to talk, if the contact's needing to talk to someone specifically in those departments, that we point them to the right department, and we're not going to be investigating or have any information about investigations. So at the end of the day, it's not always easy to get everyone on the same page within a department, a program, an agency, or even in our broader profession, but we can build comfort in rerouting when something is outside of our scope. We can resist the pressure to gather and document information solely for reporting purposes, and we can keep balancing the standard ethics we've held to with the practical real-life ethics we live by, always with compassion at the center of what we do. And that is our goal at the DVHopeline, is to be collaborative, to be a support, and that kind of goes, I know it's at the end of our time, but if anyone has questions, that is, or this is where we'll open up to any questions. And we just want to say thank you for being at this training, for being present and engaging, even sometimes when we don't want to be in during trainings.
You can feel free to come off mic and ask any questions that you'd like.
And I also put into the chat, which will be part of the follow-up materials as well, a flyer that is readily available for you all to share too, with how folks can get connected to our phone number, our website, that you can also access through the New Beginnings main page. But I put the link also in the chat, and also to know that you can access the chat through our main landing page. And so I put those resources as well into the chat.
There's a question in the chat.
I'm going to stop sharing and then I can read the question. How do you ensure that all the survivors receive the same level of care when advocates have different backgrounds and knowledge? An example is housing, legal, etc. experience. Jazz, I'm not trying to pick on you, but I think you would be the best one to answer this.
Oh man, put me on the spot. Thanks for asking that question, Erin. I think there is a piece here of we do our best, right? You named it. We all come into the space with different experiences, both lived and professional experiences. And so it really is, rooted in supporting our advocates and making sure that they are getting opportunities to increase their knowledge, whether that is through individual supervision, whether that is through engaging in trainings that are out in the community, engaging in those peer connect spaces and shift meetings, to really hear from their peers on how they move through some of the work as well. From a logistical standpoint, it really is about documentation. And documentation really is a piece that can be hit or miss depending on whether or not we have consent to save people's information, but it allows us to continue that care to the same level when our advocates are following those procedures that we have outlined to ensure our documentation is consistent. So we know where the last advocate left off and where to pick up. We've also now maybe the last 4 months and maybe 5 months, if not longer, we have been able to engage in opportunities to really deepen our knowledge around DVPOs, family law, and continuing to look for other opportunities when we identify those gaps for advocates to increase that knowledge. So recently, we completed a 6-week series around domestic violence protection orders with the King County Protection Order Advocacy Program, and we really dug deep into the nitty-gritty of start to finish, how to go through that protection order, what things come up in hearings, how can we set folks up for success and know what to expect if they're going through the hearings pro se. What does it mean to be pro se, right? So all of that. So there are certain areas where there is still support that's needed, but there are a lot of areas now where advocates are truly aligned in the experience and the advocacy that they bring to the table. Same with family law. We did a 3-week series with Eastside Legal Assistance Program here in King County, really just building on our existing foundation of family law. Legal advocacy, as I'm sure many of you know, and housing advocacy are two of the biggest needs that we encounter. So really just getting the chance to connect with community partners and hear what they're seeing how it aligns with what we're experiencing at the DVHopeline through our contacts with the community, and finding ways for us to engage in trainings and those other spaces that I named to bring us all into alignment.
I think the other thing I will add on top of that is being able to know part of the restructuring we did in 2024 was to be able to provide more individual and group support for advocates as well, knowing that there is many different components to advocacy, and to be able to have individual spaces where individual and group spaces where advocates can feel vulnerable and not just present their best cases like, oh, I was able to help everyone today, but to be able to be vulnerable around the challenges and how this is really hard work that is being provided on the phone. And so be able to support advocates too of like being able to walk through scenarios similar to what we did today for folks to also share how with the different contacts of like, oh, this is my approach and I found that this was helpful for them. What is kind of the approach that you've been taking? And so there's this ability to deepen also that peer support, as we know that that is really critical with growth learning, not feeling like you're the only one experiencing like a challenging caller. And so I think that that's another piece of us investing in the infrastructure of how peer support is a possibility and is offered and is accessible. And we also have periods of time where advocates can connect with one another for that community building as well in a remote workspace. And to know that like the well-being of advocates being able to support themselves allows them to also support survivors. And so we really do make sure that we focus also on that well-being piece. So our advocates were able to retain them, also mitigate those effects of compassion fatigue, burnout, and emotional crumbling that comes with this field for sure. And I see that we are at time. I think that we're able to stay on for a few more moments too. And then we can also make sure the questions that we don't answer in the chat, if we can get those, and we'll be able to respond to them in a document as part of a supplement resource that we send out to folks. Thank you everyone who has been engaging. This was a wonderful opportunity to be in community with all of you and to hopefully uplift how we can be supportive to you as advocates, as providers, as survivors, and also to support the amazing work that you're already doing with clients and residents in your capacity in the community.
Thank you so much. We just really appreciate that you were here. I'm so glad that I was able to host this today. I think folks really learned a lot about like, just interacting with callers when they reach out and want to have conversation with us. And I think you really aligned it in a way that it's a conversation, not like anywhere where someone would be intimidated by the call. So I think you really laid it out and it seems really well. And I know people have asked for the slides and the information. And I really hope folks can go back and share some of this with your other advocates, just on how to respond to callers or connect or talk with callers. I think it's so important that we prioritize their needs when they're giving us a call. So I think you guys really laid that out today. So I appreciate your time with us. We'll send, we have your information, Adeline, we'll send it to you.
Thank you so much, everyone. It was nice to catch some familiar names as well.
And all your information is also public to your phone number. So, okay, great. That's great. Yes, again, this is so helpful. Someone says, see us on game day. Yes, we're going to have the game day coming up in July. Check our website. Please check our website for other trainings that are coming up and our Refuse to Abuse activity that we have in July. And don't forget our conference is going to be in September. So registration is open. Please register for